Hello everyone, this is Nurse B with Buzzing with the B. Today we'll talk about things you can do to prevent the development of heart disease and to address the risk factors that you may have. If you have not had an opportunity to go to the Heart Quiz website, please try to do that now so that you can identify your risk factors and know what your heart age is. The website is displayed above me right now. Before I get started, I want to direct your attention to the subscribe button listed below the video and the like, share, and subscribe icon that's floating around on the screen. If at any time you want to follow me or send this video to your friends, please press one of those buttons. Now let's get started. Remember I told you that there were some risk factors that were not modifiable, and that's your family genes and your age. There's nothing we can do about that. But the things that we can do something about are 7 risk factors. Those risk factors include unhealthy eating, smoking, overweight or obesity, lack of exercise, stress, high blood pressure, and elevated cholesterol. These are the things we're going to talk about at this point. The first risk factor is unhealthy eating. All we have to do is just to eat smart. One way to eat smart is to have a rainbow plate. When you have a rainbow plate, you have multiple colors on your plate. Those colors come from vegetables and fruits. And these foods are also high in fiber, and they will help lower your cholesterol. The second thing you need to do is to stop smoking. Make your body a smoke-free zone. If you don't smoke, don't start. If you do smoke, please stop. There are several aids out there that can help you to stop smoking. They include nicotine replacement patches or gum, taking medications such as Chantix, or just going cold turkey. You pick a date you're going to stop smoking, and you buy no more cigarettes, and you get rid of all the cigarettes that you have. It's got to be tough, but you can do it. Think about it this way. You have overcome many obstacles in your life. You have done things that were hard before, and you succeeded. You can succeed now. Now, I want to warn you. If you decide to take that nicotine replacement patch, they start at certain levels, 21 milligrams for so many weeks, and then drop down to 14 and down to 7. You cannot smoke at the same time because that increases your risk of developing a heart attack. So no smoking while you are wearing that nicotine patch. The third action is just to control our weight. If we change our diet and make our diet more healthy, we will control our weight. So you want to have a body mass index of 25 or less. My body mass index was 32. I've been eating out of control. I did start a weight loss program, and I am proud to say that I have lost 6 pounds since February 1st. This will help my blood pressure and my cholesterol, which are 2 other risk factors that I have. The fourth risk factor is lack of exercise. We need to exercise at a moderate pace, 30 minutes a day for 5 days a week, and that equals to 150 minutes a week. Or if you want to do vigorous exercise, meaning that you can't talk while you exercise, that is 75 minutes per week. Last, you can just count steps. You can get your fitness watch, or if you hold your phone in your hand, it will count your steps also. I love to walk, and I love walking outside. So it gives me a pleasure to walk outside. And on top of that, it helps to reduce my stress, which is our next risk factor. Stress has a negative effect on everything in our body, and especially our heart. It can increase your blood pressure and lead to heart disease. We have to learn how to manage the stress and how to decrease stress in our life. Now, one way to decrease stress is just not to worry about things you can't do anything about. Most people's stress is family, finances, and marriage are the biggest stresses in their life. So to help manage that stress, you need to make your plan, number one, to get rid of some of the problems that you have in your life. Make those realistic plans and give a date to get rid of them. Uh, Next, engage in some activities that will help to alleviate your stress. I told you that I like walking and I like being outside, so that helps alleviate my stress. Another thing that helps to alleviate my stress is just to plant some flowers because I just love flowers. So think of things that you do that can help alleviate your stress. Some things may be just having a quiet time, reading your Bible, prayer, meditation, reading a book, gardening, exercise, listening to music, or anything else that helps you. The last two risk factors will require monitoring by you or your doctor. The first one is your blood pressure. Your blood pressure should be no greater than 130 over 80. The top number is the amount of pressure in your heart when it contracts to push blood out of your heart. And the bottom number is the amount of pressure in your heart at its resting phase. Some people who have high blood pressure will have symptoms when their blood pressure began to arise. Luckily for me, I had one symptom. So my symptom was that I would wake up in the morning with a tremendous headache and it hurt so bad. And I would just actually put my hand on top of my head and just press down like that because it just felt like the top of my head was just going to blow off. And so I said, I need to start taking my blood pressure and see what it is. So when I went to work and being a nurse, we took my blood pressure and it was high. So we decided to take my blood pressure 3 times a week for 2 weeks. It remained high. So I had to go to the doctor. And when I went to the doctor, it was high that day. And I took my readings with me so that my doctor would know that I had been monitoring my blood pressure. My doctor put me on some blood pressure medicine. I had to have a second dose added later because I could not get below 130 over 80. Now I'm happy to say that my blood pressure has been running around 124 over 72. Now, I still have hypertension. I cannot stop taking my blood pressure medicine because it will start to rise again. Now, if I lose some weight, I may be able to stop taking my blood pressure medicine if my doctor says I need to do that. So don't just stop taking your medicine on your own. Go to your doctor and get the advice of your doctor before you stop taking any blood pressure medicine, because some blood pressure medicine has a rebound effect once you stop taking it, meaning that your blood pressure will be higher than when you started taking the medication once you stop. Okay? Last, take control of your cholesterol level. Mine were high. My total cholesterol was greater than 200, and my low density lipoprotein cholesterol was greater than 100, which is optimal. However, the higher end is 151. I am going to have to do something about that. Now, one of the things to do about that is to eat healthy and eat foods with fiber and to exercise. So I have started doing all of that. So you will need to go to your doctor, and your doctor will need to monitor your cholesterol. If you are over the age of 30, you should be getting a cholesterol level every year when you go and take your yearly physical. Do you take your yearly physical? As you age, you really need to check on your body because things can be happening in your body that you don't know about. So a yearly physical is paramount for everyone, every adult. This concludes my discussion of the risk factors for heart disease. If you have some of those risk factors, I hope that you will join me in working on those risk factors. I am going to come back in 6 months to let you know what my cholesterol levels are and my weight and how I did over the 6 months period. This vlog is for healthy living purposes only. It cannot supersede the advice of your doctor. So please, if you suspect you have a heart disease or you have multiple risk factors, please see your doctor. Thank you.